Gun violence has been top of mind for many people around the country in recent days, and that's not all we've seen on TV in the past few months, as war and natural disasters just add to the tragedy. For parents, this can bring up a lot of questions and anxiety for their kids. Joining us now to talk more about this is Dr. Mathur, general pediatrician and mental health expert with UW Health Kids in Madison. Dr. Mathur, thank you so much for joining us this morning.
Thanks for having me here.
And so what are some key do's and don'ts for parents to talk to their kids?
Yeah, I think it's really important to ask your child what they've heard about a certain event. And after listening, really ask, what questions do you have? I think it's important to be open and honest about what's happened, but really age appropriate in terms of your response. I think it's also important not to share graphic details or unnecessary details about tragic events, and really try to avoid having them see repeated graphic images or sounds that may appear on television, radio, or social media. And I think lastly, really just knowing what's happening, just keeping up with things in the news because, older children who have access to social media or other apps on their phone, they will see what's going on, and we need to be ahead of that and know as much as possible what's out there so we can take steps to talk to our children about what they are seeing and hearing.
Right, and let's break this down further. So what should be the approach for different age groups and kids with special needs?
Yeah, so for young children, even children as young as 4 years of age, they may hear about an event, and it's really best if they hear about it from a parent or caregiver rather than from another child or from the media. So using language your child can understand, but really avoid being too vague. So the most important thing to convey is, it's okay if this bothers you. We are here to support each other. For grade school children and older teens, it's important to watch the news with them and to pause and discuss what's happened. You could kind of let them know that, this happened in this city, in a different state, and there was a disaster and many people were hurt, but the police and government are doing their job so that they can make sure that this doesn't happen again. And for children with disabilities, really adjusting the language based on your child's development, and also finding activities and other ways to comfort your child that may be specific to your child would be important.
And what are signs parents should look out for if their child might not be coping well?
Yeah, so we can see a lot of different manifestations of tragic events. So some kids will have sleep problems, difficulty falling asleep or staying asleep. They might have nightmares, physical complaints like just being tired, having headaches, a change in appetite, definitely changes in behavior. So regressive behavior, acting more immature or more demanding or clingy. Some older teens may engage in or change their use of tobacco, alcohol, or other substances. And we for sure see emotional problems. So sometimes sadness, depression, anxiety, fearfulness. But, as a parent, you know your child best. So if you have any concerns about how your child is doing, call your pediatrician or get in touch with a mental health provider.
It's such a difficult thing I'm sure many parents are dealing with right now. So thank you so much for coming on today and sharing this with us.
Thank you.
All right.